are joining us from Ethiopia. I believe they will join us, Dr. Argesh from the EPHI, and Nifin, maybe the Ethiopian team would know him. And then afterwards, we are going to have a coffee break, and then we now come into and learn more about the structure of the policy briefs. But I promise you, this is very interactive. There are people who have worked with policy briefs longer than I, so we will get to learn from each other. Then we're also going to have two presentations on data analysis and presentation. So Irene and Samuel are going to share with us their work. We are going for lunch, and then we are going to use their information to try and prepare two policy briefs today. We can start. If we finish the policy briefs, that will be wonderful. If not, we will continue working on this. So they are actually deliverables for both Arise, Nutrient and DASH. So they are actually going to be used, and they are going to be submitted to the funders. Can you hear me? Could you hear me before?
Yes.
Okay. Thank you. And then Christine and Irene will show us how to integrate visuals and infographics. And then later in the day, Sachin will join us. He'll be awake finally. He's currently in Boston. So he will join us at 4. So we'll have a peer review and feedback session. And then we will close the day with Professor Ayo, just talking about the reflections and the next steps. The main one being training of trainers for the policy briefs for both projects Arise, Nutrient and DASH. I think we all are under either Arise, Nutrient and DASH, right? Yeah. Other than change makers. Okay, you're welcome. So without much further ado, it is my honor and privilege to welcome Dr. Sanjana Bhardwaj, the Gates Foundation, to give the keynote speech. Thank you.
I worked in Nigeria for over 5 years in a different role. So it was prior to the foundation when I was working with the United Nations, with UNICEF actually. And a lot of the work that I did at that time as well was really linked to how we could take research and what works and the information that works really to the policy makers, the decision makers, and make sure that we take things to scale. So thank you to Joy and the entire team here for giving me this opportunity to speak to you all today about this. Very, very excited to be part of the thing today. So I think some thoughts from my side. I think what lies at the heart of real progress is when we can really translate research into policy, into practice, into impact. I think I'm speaking to a room of people that are working on this every day, that are starting careers, some of you in this area, and have spent a lot of energy and time in trying to make this happen. And still, I guess you would agree with me how challenging it is. And we're not really able, despite having that knowledge, we're not able to quite translate it. There's in today's era, you are really sort of, I would say, surrounded by data. There's an inundation of data wherever you turn. There's a lot of information available. There's a lot of innovation in data and the way you kind of collect the data, the way you use the data. But I guess the real challenge is not just in generating the knowledge, but in acting upon it and actually doing something with that knowledge. And I think as researchers and people that work to collect the data and evidence, the real sort of I would say, satisfaction or the real inspiration comes when that data and research is used to actually change the lives on the ground. So some thoughts here, but before I go into that, I wanted to share some examples, some real life, some examples that we know in today's world. I think many of us have worked in the field of public health and know the sort of case that was made for insecticide-treated nets. There was a lot of burden of malaria, there was a lot of work going on as to what one can do to actually address this issue. And it was research that showed the impact that insecticide-treated bed nets would have. And it was taking that information that actually helped us translate that into actual programs, get funding for those programs from the Global Fund as well as the President's Malaria Initiative at the time, and actually make sure that you're able to reach those bed nets to people and save lives, women, children, and population lives. There's also the big case that took place with tobacco and tobacco control. And we know that this is historical. The data that was produced was unequivocally clear that what happens with tobacco, use of tobacco and the harmful impact of tobacco use. And that actually led to a lot of global policy shifts from WHO as well as then translating into country-specific policies. There was also a lot of data that was generated for integrated maternal newborn child survival programs. Now we know there could be vertical programs that are delivered well with quality and at scale. But the Lancet series in 2016 actually showed us the impact that one could have. It was research that was really systematically brought together evidence that showed that integrated programs can actually have a multiplier effect in terms of saving mothers and babies and children's lives. And that actually led to a lot of shifts in many countries and their policies, especially Bangladesh, and I know we've got Ethiopian colleagues here from Ethiopia that actually did a lot of work on that, including community health workers and the work that was done to actually change the face of that. Something quite recent, and some of you might be aware, and I know we're here for the next week with adolescent health, is the HPV vaccine, and what we've seen in recent times on research with HPV and what is the impact of that. And actually, it was not just the issue about the vaccine, but it was the issue of delivering that vaccine at scale. And in fact, some work done in Nigeria itself, in Kebbi State, actually showed how could you really make sure that parents, and you're able to deliver this vaccine for schoolgirls in schools. And it was research that showed us the barriers that are faced and how you could address that, how you could sort of bring parents into that sort of circle of trust and making sure that parents are part of that scale-up of HPV vaccine. But more importantly, it was also traditional leaders in Kebbi that made the difference, that endorsed the program, and that actually helped generate even more confidence. So all in all, I mean, what we learned in Kebbi actually helped scale it for the rest of Nigeria and make sure you're taking that program to scale to sort of reach all young girls and adolescents. So the point is very clear. The case is very clear, right? You have the research, you have the data, you want to make sure you translate that into action, and there's so many examples. But so what still holds us back? Why aren't we able to really get the work that is done by researchers all over the world into the policymakers' sort of attention, and then the financing of those policies becomes even more critical, because having the policy is one step, but actually financing the execution of that policy becomes the other step. And of course, then the third step of actually monitoring the impact of what you've done, because you want to continue garnering, getting that support to continue implementing your program. I think some of the reasons it is used, one faces challenges on the ground. And this comes from my own personal experience of working in this area for a long time now, but also what we see in terms of what we see across the world and what has been seen. One is, and I think you're going to be discussing that today, is really how policy briefs are written and put together, and how they actually reach the people who make those decisions. So a lot of times, the briefs are not written in a way that actually resonate with what the policymakers are looking to understand and see. So a very critical aspect is, how do you take data and research that has been done and translate it to a policymaker language, so to speak, and really making sure that the policymakers are able to see that link between what you've done as research and then how do you apply it in a real world setting. That's one piece. The other piece is the timing. So it's extremely important for a policy brief to reach the policymaker at the right time, because without having
that policy cycle, the funding cycle, really in sync with what the country is trying to do, you're not going to be able to make that difference in really getting that policy to get financed and go to scale. So both the things are equally important. The third thing that is important here is how you co-create some of these solutions. So doing the research, sitting in a little bit of a silo and in a room like this and designing a study and doing the research is one thing, but actually co-creating that research with the policymakers, with the decision makers, to really make sure the policy brief, once done, actually answers some of the questions that the policymaker had in the first place, becomes even more important. And so co-creating the research that you're doing is another very important aspect. The third thing I would say is really the financing piece, a little bit of attention. And it's one of the areas that I'm personally very passionate about, because I think the policy to action, to impact, that whole cycle that we have, without financing, without resources, we're not going to get to where we want to get to. So again, the co-creation shouldn't only happen with the policymakers, but also bringing the finance sort of stakeholders together. And of course, the beneficiaries that are very critical, whoever you're doing the research for. In this case, if it's the young people or adolescents, or if it's the women and children, or whoever, whatever is the focus of that research, actually making sure you're building in some sort of co-creation in that so that you're able to really get that policy brief to scale. I think the other piece, and hopefully you all will be discussing some of that, is the visualization of a policy brief. I mean, often enough we write the policy briefs for a very technical audience, and how should I put it? It's very obvious. It's very obvious to a technical audience what you're trying to say, but it is not that clear for an audience that doesn't understand the real nuances of what you're trying to communicate. And so really bringing some of those communication partnerships together, people that are skilled in really translating those briefs to a visual representation or a representation in the way that could resonate with different audiences becomes critical. So once again, I think the criticality of moving from just the research to the policy, to the finance piece, to the action piece, I couldn't re-emphasize that more. So let me end by saying that let us try to see how we close this knowing, doing, and act, you know, the know, do, act sort of triage or cycle, and try and really be conscious right from the word go and the start, how we want to make sure we are starting with the end in mind. So designing the policy brief, knowing what you want out of that policy brief and how you want to really make sure you close that know, do, act cycle becomes absolutely important. So I want to leave you with these thoughts and wishing you all the very best for today's sort of one-day workshop on really translating policy to action. Thank you very much.
Amazing. Thank you so much, Dr. Sanjana. So just to reiterate, effective communication, know your audience, know the decision makers, and know how to effectively communicate with them. The other major point was on co-creation, not only just at the design phase, but throughout the entire policy-making process. We are focusing on financing for impact, visualization, especially in a way that the decision makers will be able to absorb it as easily as possible and actually use it for their work. And communication through from the know, do, and act gap. And most importantly, start with the end in mind. And that's something we are going to do today. So thank you so much. I realized I didn't allow Diana to introduce herself, so please. Thank you.
Hello everyone, my name is Diana Kazak. I'm Moldovan, who works for the Gates Foundation in Seattle, in the United States. It's a pleasure to be here, to learn from all of you, connecting with you, and I'm looking
looking forward for the next 2 days.
Thank you so much. Is it allowed if they have any questions to ask? Anybody have a question for Dr. Sanjana? Comments, questions? I'll make people talk. Yes, Riza, would you like to say something?
Sure. I have a question around you talked about the vaccine work in Nigeria and the integration of the kind of traditional chiefs in that session. Can you talk a bit more about how you keep their engagement, not just for kind of the start of the work, but how they might show up throughout the rest of the process?
Sure, I think you bring about a very, very critical point, because sometimes what happens is that you, and in this case it's the traditional leaders, but it could be anyone, we are very good at engaging the stakeholders in the start of any program, because obviously you are wanting the support and you want to kickstart something, so there's more enthusiasm and there's more energy. But throughout the process, once you've got that done and you're actually starting the work, it's very easy to sort of drop the sort of ball a little bit and not go back to them. My work in Nigeria when I was there really showed me that the more you can actually bring those stakeholders with you throughout that process and actually celebrate the wins with them, it really adds even more power to the work you're doing and actually sets you up really well to even continuously do the research and be with the, sort of answer some of their questions as it goes along. With the traditional leaders in particular, I think getting them onto, I know the world of research works with working groups and steering committees and things like that, right? And so really bringing them on as a partner with you and sort of having them, get them a seat on, if you have a working group, if you have a state steering committee, if you have a sort of technical advisory committee, but just bringing them on as advisors and having them engaged in understanding where the problems are or where the successes are becomes even more important. So it goes back to what I was trying to say, that just keeping that entire cycle going constantly, but making sure that you've continuously kept everyone in the loop becomes even more important. And one thing I forgot to say, you might have done that traditional leaders in one state, right? But that can actually become a champion state in some ways. And that's very powerful in a research to policy to practice piece as well, because you want champions to be able to really come out and say, this worked for us, and that would actually help you go to scale and sustainability even faster. And so keeping them continuously involved becomes even more important. And surprisingly, we think they won't be interested, but it's just the opposite. People are actually very keen to be engaged in all of these things right from the beginning to the end, and not just, just coming in bits and pieces. So thank you. That's a very, very critical point.
Thank you so much. Any final comment or questions? Oh, yes, Monica.
Thank you very much for sharing all the work you've done and the progress in really having this bridging gap between research and how policy briefs are communicated to policymakers. I had a question more on that communication part, like moving from the no act and like how to do it, is how can you really like promote this policy brief writing among researchers? Because research methodologies can be so vast and also have like a lot of detail and depth into it. And if you have your research tailored towards action and policy-oriented goals, then you'd also want to make sure that researchers themselves have this in mind as they communicate their findings. So how do you bridge that gap within the research part of things?
Yeah, again, a very, very critical point, which I'm sure is in everyone's mind in this room. My take would be to be crystal clear and sharp on what is it that you're trying to solve for. Like, what is it exactly? Is it that you're trying to influence a policy change? Are you trying to bring about a new policy, completely new, something that is so different, now that's been done before? Or is it something that you're tweaking in the policy. So it was, you know, for example, for HPV, it was 2 doses being brought to 1 dose. So I think getting really sharp right from the beginning as to what is that question you're trying to solve. And that will only come if you co-create with the policymakers themselves. Because hearing them, you will realize what is the question they're trying to answer. So as researchers, we may have a question to answer, but the policymaker may have a completely different question to answer. And so really hearing that piece and then bringing it to the table and saying, okay, how do we make sure there's a win-win so that the researchers are getting their answers to what they're looking for, but at the same time, the policymakers are also getting it. So you're starting with that understanding and being sharp about what you're trying to influence, and that actually will help you write the most powerful brief, because then you'll be so crystal clear. Often enough, that's a stage that's missed. Because we do the research and then we are trying to translate that into a policy brief, you know, and things like that. And then the second point I would say, and the last one, is the context and the nuance.